This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. Thomas, excited about these COVID vaccines.
Well, great. What's the latest?
The latest is, in addition to the two that we already have, we're hoping very soon to have Janssen, and that is a one-dose vaccine.
That will be a game changer for sure. I like that idea, and that we're getting more options is fantastic too.
Absolutely. And the Janssen, potentially, it's a good vaccine. It'll help prevent serious illness and hopefully death, but it can be given in one dose. That is tremendous when you're dealing with homeless populations or people that may not come back for that second dose.
And the numbers are down too, so yes, an air of optimism going on right now. This is great. We've been looking forward to this.
Yeah, absolutely. We need something to be optimistic about. And speaking of some of the most vulnerable in our society, we've got a guest today that's going to talk about how community health needs assessments help guide and direct them in those areas.
Now, that's a big word. Will you break that down?
Yeah, the community health needs assessment is where they assess the needs within the community with certain patient populations and many of the people that are affected by the social drivers of health: transportation, food insecurity, economic status, and so on and so forth.
This is something the publicly funded hospitals are required to do by law, and Parkland Health and Hospital System has just completed their most recent assessment and a year-long analysis of it. And to tell us, first of all, what the general objectives were, here is Jessica Hernandez. She's a Senior Vice President of Community Integrated Health at Parkland Health and Hospital System.
The overarching goal of the CHNA was to identify the geographic areas and populations that experience the most significant health disparities, including racial minorities, low-income populations, and underserved individuals. One of the things that were required as part of the CHNA is to create an implementation strategy to meet the needs that we identified through our assessment. And that is what we have spent the past year doing.
And you know, Thomas, when we look at the social drivers of health, and I'm talking about things like people have food insecurity, lack of transportation, lack of education, lack of economic well-being, all of that impacts your health care. And in certain zip codes, many of those social drivers of health impact the overall health of the people. They don't have the coverage nor the access that they need to get appropriate health care. And it impacts not only the way they live, but how long they live.
Actually, Jessica talked about some of the zip codes that were affected by this. Just a few: 75210, for example, 211, 75215, 216, 217. These are mostly South Dallas zip codes, and that's why the focus of this public initiative is headed to these areas where the needs are the greatest.
It's a great initiative that's going to help all of those residents. And if we help those residents, we're helping North Texas.
And from Jessica and Parkland's perspective, here is what that help looks like.
We look at our public health practices. We look at community-based participatory research. We look at our strategic planning for health services across Dallas County, as well as looking at qualitative and quantitative data analysis.
You know, Thomas, many of the things that we just talked about in zip codes, the pandemic has really impacted it, but these folks at Parkland have continued to do these programs. And, you know, even with virtual, there were barriers. Some people didn't have broadband. Some people may not have had internet or computer, and yet they've prevailed and continued these programs.
We've pointed out several of the, as we say, quote unquote, benefits, the positive side of this pandemic. And one of them is that we've had to learn to do things differently or to figure out, as you say, what we were doing before in this situation. Because in these cases, this is why this is so important. We are literally talking about life and death.
Absolutely. Many of the things that we know that are being treated and many of the things that were found in these assessments could easily be life and death. Many of the main areas of the assessment have been revealed, and there are efforts in 2021 that are focusing on them. And these are being continued in spite of this pandemic.
Access to care and coverage in terms of health coverage, health insurance. Health literacy was also top of mind for individuals. Behavioral health services, lack thereof. Maternal and infant mortality, sexually transmitted infections, and then, of course, chronic diseases such as hypertension and diabetes. But you are correct in that while those findings were not a surprise to the organization, because we work primarily, our health centers are in Southwest and Southeast Dallas. We work in those communities. The life expectancy variation by zip code, I think, took most by surprise.
Thomas, one of the things, maternal mortality, is near and dear to my heart. There are many women, especially in Texas, that experience maternal mortality. And we've really got to focus on this. And I am so glad in the community health needs assessment that that's something that is really being examined. And we've got to help these women.
So first, Parkland did this big assessment. Then they took a year to evaluate the results, and you're going to see why. And then they identify where in the community it shows up the most. And then they finally boil it down to the specific issues that need to be treated. Jessica is going to tell us what the list is and check out how many of these apply to most of us, and specifically one area that we are going to focus on in the next segment. Here again is Jessica Hernandez from Parkland Health and Hospital System.
And so some of the initiatives that we've identified as a result of our findings from the CHNA are initiatives surrounding hypertension, diabetes, breast health, behavioral health, maternal and infant mortality, asthma, sexually transmitted infections, and then access to care. So as an example, we do have a multidisciplinary team for each one of these initiatives that meets and identifies the intervention based on the findings within a particular zip code or within a particular group.
Some good news, Thomas. House Energy and Commerce Committee is looking in this COVID-19 relief package to extend maternal mortality to 1 year. Let's hope that happens.
What you just heard is about it's a couple of visits kind of program. It's a limited program, and then the funding runs out. And what Jessica was just saying is that when it does, then, of course, these visits stop, and that's where the problems begin. Well, there are solutions, and that's what we're going to talk about next on the human side of healthcare, solutions to maternal mortality. Stay with us.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back to the human side of healthcare. Thomas, what a great segment we just had on the community health needs assessment. One of those areas, maternal mortality, kills many women in Texas every year. We need to drill down, understand it, and how we can correct it.
And Steve, to do just that, we're welcoming back to the human side of healthcare Marjorie Quint-Bouzid. She's Senior Vice President of Nursing in the Women's and Infant Specialty Health area at Parkland Health and Hospital System to tell us about the scope of this problem.
The concept of maternal mortality has received a significant amount of public discourse just because we got some numbers several years ago that would indicate that moms are dying at alarming rates during and after childbirth. The CDC defines maternal mortality as any death that occurred from a pregnancy-related condition during a pregnancy, after delivery, and all the way up until 1 year post that delivery event. While there is some confusion around the actual numbers and whether or not they're accurate, what we do know and what all the data shows is that we do have a problem nationwide, and we also have some higher rates in Texas than we would like to see. Some of the reasoning around why the rates are being questioned is that it's just the way we collected data nationally. As of about 2018, every state in the nation has adopted a checkbox on the death certificate that indicates the pregnancy status of the woman. We use that along with some other proxy data to determine maternal mortality. So by any count, whatever we use, it still indicates that while all other developing countries have seen a downward trend in their deaths of women during the childbearing, of pregnancy-related conditions, in the United States, we still continue to see a slight incline. Texas mirrors the country, so if there's an incline in the U.S., there's an incline in Texas as well.
I want to make sure I understood you, Marjorie. So you're saying when you look at the United States and compare us to other countries, we're really increasing. And in Texas, we're increasing probably more than the national average. Did I hear that right?
So you're correct. Of the developing countries, they're reporting a downward trend in maternal death, pregnancy-related deaths for mothers. In the United States, we're seeing a slight uptick. In Texas, the numbers we're seeing has not decreased and may potentially be increasing. The reason why there's some hesitancy to have finite numbers is just the way we collect data. But based on there was a task force that was formed by the Texas State Department of Health Services, and it's called the Maternal Mortality and Morbidity Task Force, and they have reviewed all of our maternal deaths, and published a report in 2018. That commission has actually confirmed that the number of maternal deaths in Texas is higher, is one of the highest in the nation, and that there are some significant disparities around who's being affected by it.
That's an interesting thing you said right at the end, the disparities and people being affected. When you look in statistics and you look at the breakdown of the data you've gotten, is one group of women more affected than others?
Yes, the data Texas data does indicate that non-Hispanic Black women were 2.3 times more likely or had a higher rate of maternal mortality than non-Hispanic white women.
And to help our listeners really comprehend this, Marjorie, what are some of the leading causes of maternal mortality?
That's an interesting question. I'm glad you asked. We talked a lot about maternal mortality, and the thing that's a little bit harder to wrangle is what we consider morbidity, which is any short-term or long-term health impact. And that sometimes can be worse, right? Because you're living with lifelong conditions that could be preventable. According to the Texas Commission, the top 3 reasons for maternal death in Texas was, interestingly enough, due to substance use disorder, hypertensive conditions of cardiovascular system, more importantly, hypertensive disorders, eclampsia, preeclampsia, as well as mental health, behavioral health.
Sometimes, Thomas, when you look at some of the causes of maternal mortality, it's a lot of gray area. We cross over. For example, obesity ties into cardiovascular. Obesity ties into diabetes. And as a result, the lines get blurred. I think we need to drill down a little bit and look at cardiovascular, for example, because overall, that's probably the leading cause, but it dovetails back to obesity.
We're going to bring in an expert now, Dr. Kamala Tamirisa. She's a clinical cardiac electrophysiologist at Medical City Heart Hospital. And also coming up later in the show, we're going to be talking about this again. So we're going to really drill down on this. Right now, Dr. Tamirisa explains why focusing on cardiology for these new moms is so important.
Cardio-obstetrics, that is the field which is integrated between cardiology and obstetrics. Why is that field so important? Because if you look at the number one cause for women who die during pregnancy or maternal deaths, the number one cause is cardiovascular disease. Heart disease is number one. So as cardiologists, we need to tie hands with our obstetrics colleagues and start to recognize this disease, because these women do not present with classic symptoms of chest pain. They do not present with the same symptomatology that other women or men present with. So we need to have a very high index of suspicion and recognition. So we need to approach this with education. So that's from physicians and the clinical side. What can we do as a system? And, a few things obviously is educating the patients about health lifestyle changes, obesity, why is it bad, eating fast food, or, how can we change those? So educating patients, but that does not stop with educating patients alone. We need to make the healthy dietary choices more affordable. We cannot, I know it's an idealistic world. I would say, why don't we tax, the fast food places higher and lower the taxes on healthy organic diet, so to make it more affordable for people, because poverty is a real issue. And reducing the barriers out in the community, socioeconomic barriers, and for the healthcare systems to go out, do community work, again, towards helping, educating patients and even helping the poverty. The last point is collecting more data and research. As you know, the data collection has not been great. We initially limited the data collection to 42 days after delivery with Medicaid coverage. Then we said, no, that's not when it stops. The mortality continues. Let's start collecting data for 365 days after the female delivers, after the woman delivers her baby.
Thomas, one thing that I've gleaned from all of this discussion, prevention is key. Good prenatal care. So anyone that's pregnant could develop these conditions, but we've got to educate them to remove this risk of maternal mortality.
So the prevention is the number one element in this. So please, if you or your friend or your colleague, someone has high blood pressure, diabetes, obesity, or a complicated pregnancy, pregnancy-induced hypertension, preeclampsia or eclampsia, any pregnancy-related complication in the past, then please seek help. Medical City Heart has a wonderful cardio-obstetrics program led by the maternal fetal medicine and high-risk OB physicians, and along with us, so we can help. And other thing to watch out would be, even if you did not have a complicated pregnancy in the past, if you do have high blood pressure, diabetes, or even a family history of complicated pregnancies, please seek help. Starts with prevention. That's how we need to, cut down these numbers. I don't want us to, lose the momentum. I want us to continue and bring it down. United States, I'm a proud American. We cannot have the highest maternal mortality rates in the whole world. We just cannot. We need to tackle this, make this as a number one priority across the, healthcare systems. And, in the long term, let's not lose the momentum. So educate yourself, reach out for help, and do more research, and give us a call.
Such an important topic and great work from all of our area hospitals to help solve it. When we come back, we're going to continue talking about something very important, our kids. and COVID, and other issues they're facing, including vaping, bullying, and obesity. All of that next on the human side of healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the human side of healthcare. You know, we've been talking a lot about COVID-19, but we have not focused on children. Today, we couldn't have a better expert than Dr. Jeffrey Cohn, who is the Chief of Infectious Diseases at Children's Health, and he's also a professor at UT Southwestern Medical School. Dr. Cohn, welcome to the show.
Well, thank you. It's a pleasure to be speaking with you.
So let's just start right at the top. How does COVID-19 impact children?
So we certainly know at this stage in the pandemic that children do get infected with SARS-CoV-2, which is the virus that causes COVID-19. Fortunately, children seem to be less prone to severe illness. In fact, there's data throughout the country, and certainly local data here in Dallas, that suggests that children can get infected, but they actually represent a very, very small percentage of individuals who are being hospitalized COVID. So that's the good news. However, children can get severe disease, and we've seen children who have been quite sick due to COVID. The other important thing to note is that even though children may have asymptomatic infection, they actually may spread the virus to others, and that's a particularly important issue for household contacts. So children can be carriers, so to speak, of the virus, and it contribute to the spread of the virus in their community.
Let me ask you also about something we've heard about recently. What is MIS-C, and how common is it with children?
So what you're referring to is something called multi-system inflammatory syndrome in children. And this is a new disease. It's very unusual to encounter a new disease, but it's clearly related to COVID. And this disease is actually an inflammatory disease, and it most likely represents an abnormal immune response or inflammatory response of the individual to the virus. So the typical story is a child will have infection with COVID. It may be even asymptomatic or mildly symptomatic. And then about 4 weeks later, they develop sort of body-wide inflammation that affects many of the organs in the body. And these kids are actually quite sick. They come in with fevers. They may have inflammation of the heart resulting in cardiac insufficiency. They have involvement up their gastrointestinal tract. They can have kidney involvement. They can also have neurological symptoms. So fortunately, it seems to be quite uncommon. But of course, if your child happens to have it, it's not an uncommon disease.
You know, we are glad that children, at least for the most part, don't get as sick as adults, but they can, as you say, get seriously sick with COVID-19, which raises the question, can children receive the COVID-19 vaccine?
The two vaccines that have been that have received emergency use authorization by the FDA, the Pfizer vaccine and the Moderna vaccine, for the most part, they were studied in adults. The Pfizer vaccine trial, towards the end of the trial, started to include individuals who are 12 years of age or older. But based on the data that was presented to the FDA, the age requirements are for the Pfizer vaccine, individuals greater than 16 years of age can get the vaccine. For the Moderna vaccine, it's individuals greater than 18 years of age or 18 years of age and older. So it's only a small percentage of the pediatric population that's actually eligible to get the vaccine. Again, for the Pfizer vaccine, you have to be at least 16 years of age.
So when you look at the COVID-19 vaccine, and I know, as you mentioned, we've got a couple out now, and soon we may even have Janssen by Johnson & Johnson. How does the vaccine work?
So the two vaccines that are now approved are actually a new platform that we've actually never used before, and it's based on what's called messenger RNA. And actually, this is a technology that's been in development now for over a decade. The first clinical trials looking at mRNA-based vaccines go back to 2008. And there have been many, many studies looking at this. And those studies have actually pointed to the fact that these may be quite effective. And basically, the way this vaccine works is that they take one of the genes of the virus and they put it into these microscopic lipid particles, if you will. And what the injection does is it actually stimulates the body to produce this virus protein. Now, it doesn't produce the whole virus, but just this one virus protein called the spike protein. And the body produces this in the injection site transiently, maybe for a couple of days, but it gives the immune system an opportunity to see this protein and develop an immune response to that protein. So the clinical trials suggest that this is highly effective. The effectiveness of these vaccines has been over 94% for both of the vaccines. So very, very encouraging. It's actually quite remarkable that the fact that this virus entered the human population just a little over a year ago, and we already have 2 highly effective vaccines.
Dr. Kahn, this is Thomas. I'd like to ask you a question on that very theme. As you were describing the messenger RNA process, could this vaccination immunize or protect us against other coronaviruses?
That's a big question now because of the emergence of these variants. And the studies are still going on now. It seems that these 2 vaccines will provide some protection against these emerging variants. And there are 3 of these variants that have gained a lot of attention. Of course, there's the UK variant that has been identified in the United States. There's the South African variant, which I believe just over the last couple of days has been identified in the United States. And perhaps the most worrisome is the Brazilian variant. So there may be protection, some level of protection provided by these vaccines against these other variants. The level of protection right now is really not clear. But perhaps the big advantage to these messenger RNA vaccines is that they can be very easily modified so that they match the spike protein gene of the variants. So one can speculate that if the vaccines as they exist now do not provide an adequate protection against these variants, then the vaccines can be modified, and one can even speculate that perhaps the vaccine will be a multivalent vaccine, for example, where the mRNA could be the mRNA of the existing strains plus the mRNA of the variant strains, and have a trivalent vaccine, if you will. And this is exactly the approach that was used for polio. The polio vaccines actually have 3 different viruses represented in them.
You know, Dr. Kahn, for the people that have received the vaccine or will receive it soon, what are some of the side effects of getting the vaccine?
The clinical trials certainly indicated that there are some local side effects, pain at the injection site, swelling, and those types of things. One of the things that have come out after the vaccine was approved and being administered on a very large basis was this severe allergic reaction called anaphylaxis that was associated with the vaccine. And those reactions have actually been studied, and the CDC has published actually a couple of papers on this. And those severe allergic reactions seem to be quite rare. For the Pfizer vaccine, it's about 11 cases per million doses. The Moderna vaccine, I think it's about 2 or 2.5 cases of anaphylaxis per million doses. So fortunately, the severe side effects or adverse reactions to the vaccine seem to be very, very rare.
Let's assume a person contracted COVID-19 and has recovered. Should they get a vaccine?
They should. One of the options that the CDC has put out there is that that an infected individual can wait up to 90 days to get the vaccine. We know that infected individuals do develop an immune response, and the data suggests that immune response from natural infection actually can last quite a long time. Now, of course, we're only about a year into the pandemic, so we don't really know the long-term immunity provided by natural infection. But it seems that natural infection does provide some type of protective immunity. Reinfections are actually quite unusual. And so that's a good sign, of course, that for those individuals who are out there who have gotten infected, they actually may be protected for some time. We don't know the durability of that protection. And again, for individuals who have had a documented case of COVID, they are certainly eligible to get the vaccine, although the option is out there to wait from 90 days from the onset of the COVID infection to getting the vaccine.
What are your thoughts on why kids seem to be less susceptible to COVID-19 than adults? Is it that they have fewer ACE2 receptors?
So there are a lot of hypotheses out there to try to explain why children seem to be less prone to severe disease. In fact, the ACE receptor story may be one of the explanations. A different way of thinking about this is that overall children seem to be less prone to severe infection due to many different types of viruses. So, for example, chickenpox. Now we have a vaccine, of course, but we know that before the vaccine, chickenpox was a relatively common disease in children. But if you got chickenpox as an adult, you were much more likely to have severe infection. That's true for measles as well, and a variety of other infections. So there's something about age and the susceptibility to viruses and the susceptibility to severe disease that we really don't quite understand. And it could be that for each of these viruses, there are different mechanics that are giving the same theme here. And, getting back to COVID, yes, it may be the ACE receptor story that explains these observations that children are less severe or less prone to severe disease. I think it may be more global than that. And again, this is something that science and medicine we really don't understand this. But the observations have been made decades, and in some cases centuries ago, that if you get a common viral infection as an adult rather than as a child, you're at risk for greater severity of illness.
This is Dr. Jeffrey Kahn. He's the Chief of Infectious Diseases at Children's Health. When we come back, we're going to ask the all-important question that many parents ask. Are vaccines safe for my child? Dr. Kahn will take that straight on when we return, as well as several other issues that our kids are facing these days, including social media bullying, obesity, and vaping. I'd also like to remind you of our podcast, Search the Human Side of Healthcare, on all the major podcast players. Good stuff ahead. Stay with us on the Human Side of Healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the Human Side of Healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back. We're continuing our conversation with Dr. Jeffrey Kahn. He is the Chief of Infectious Diseases at Children's Health. Vaccinations are in the spotlight these days as, of course, we're rolling out the COVID-19 vaccination literally across the world. And there's a very important question that many parents ask on this topic.
To our listeners out there, especially parents, should they be afraid to get their children immunized against childhood diseases, whether it be measles or what have you?
No. One of probably the greatest accomplishment of medicine throughout the history of mankind has been the development of vaccines. And to a certain extent, vaccines are a victim of their own success. We don't see measles anymore. Smallpox has been eradicated. We don't see polio or diphtheria or tetanus, and I can go on and on and on. And the reason that we don't see these horrible diseases is because of the success of the vaccine. Some of us have parents who are old enough to remember the polio epidemics, and those were terrifying times. And now, of course, we don't see polio, and it's because of the success of the vaccine. So the fear, of course, is that if we don't keep up the efforts to immunize kids against these diseases that we've been immunizing them for decades now, that these diseases are going to reemerge. And we're going to have lots of problems. And there's a big concern about outbreaks of measles because that's the most contagious disease that we know of. And in a population that's not really fully immunized, that virus can spread like wildfire. So I would certainly emphasize to the parents out there that they get their kids immunized. Now, mind you, during the pandemic, a lot of kids have not been going to their regularly scheduled appointments. I understand that. But hopefully as we get this pandemic under control, as kids begin going back to their pediatricians, they should certainly go ahead and get their shots on schedule or get the catch-up immunizations.
There are many theories people have out there. Some are based on science, some aren't. In your opinion, do vaccinations for children contribute to autism?
undeniably, they do not. And there are over a dozen studies that have looked at this that have involved over 1 million children, and there is no evidence whatsoever that immunizations are associated with autism. There are these stories out there which have been debunked, and it's actually sad that we're at this point where we're debating the effectiveness of vaccines based on a lot of just nonsense. So there's absolutely no evidence at all that vaccines are a cause of autism.
You know, people who feel passionate about that say that they've watched their child morph from a pre-vaccination baby to a post-vaccination baby. How do you answer that?
We know that the first signs of autism in young children typically develop about a year of age to about 2 years of age. And of course, that's the time where we're administering a lot of our vaccines. So clearly there's a temporal relationship. In other words, yes, the kids are getting immunized, and some of these kids are starting to develop the initial signs of autism. But that's not a causal relationship. So another way of looking at this would be, well, let's assume that we can do an experiment where we have two groups of children. One group we're going to immunize, and one group we're not going to immunize. And we're going to follow those children forward and see if there's a difference in the rates of autism between the two groups. In fact, that study was done. And in fact, there was no difference in the rates of autism between the two groups, really indicating that immunizations had no role in the development of autism. So I think that where some people get confused is because of the timing. But again, timing is not causation. And it's important to understand that particular issue.
The vaccination is one of the top medical discoveries of the last century, bar none.
I couldn't agree with you more. I often tell the residents who are on my team about when I talk about vaccines. I talk about the last case of mumps that I saw was back in 1969 when I had it, right. And there's a reason for that, and that is because we have these effective vaccines. And every year we see horrible cases of vaccine-preventable diseases. The one that comes to mind is pertussis or whooping cough. And, I've seen infants die of this disease. And it's a vaccine-preventable disease. And it really speaks to where we are, that we're still seeing children die of vaccine-preventable diseases. And for the people who are anti-vaxxers, I don't know if they actually consider that. Unfortunately, there are some horrible stories out there of parents who didn't get their kids immunized, and they developed a horrible disease, in some cases a life-threatening or fatal disease, and now they have to live with that decision.
Tell us about, in just general childhood wellness, the issue of childhood obesity that kids are facing today.
Well, that's also an epidemic, and we're seeing it, and it's been developing now for decades. It's having a huge impact on, of course, children's health. We're seeing diseases now in children that beforehand we never saw. For example, type 2 diabetes. When I started out as a pediatrician, that was never seen in children, and now we're seeing it. So it's a public health issue for sure, and there doesn't seem to be any indication that we're changing the arc of that particular pandemic, or epidemic, I should say.
So as long as junk food, snack food, fast food is the thing, we're going to be dealing with it, basically. Is that the synopsis of that?
Yes, indeed. It's always striking to me that we often spend a lot more time, energy, resources directed towards therapies against obesity-related diseases rather than using the resources to focus on prevention strategies against some of these diseases.
Another area is social media. Adults are even experiencing this now, but the kids have had it for quite a while. Bullying, how is that affecting our kids?
Well, to a very large extent. Obviously, this has been on the radar now, and of course, it's been exacerbated by the fact that a lot of kids are stuck inside, and their only interactions with the outside world are through their phones or their computers. And again, this is a social issue that I think has been amplified by social media, and I guess to a certain extent, maybe the cat's out of the bag, but it's having these profound implications that I don't think we appreciated early on in the internet era.
What kind of advice do you give to parents if their child is exposed to bullying online?
Open dialogue. I think that sometimes children are very inhibited to talk to their parents about this. I think the advice for the parents would be, don't wait for your child to bring it up to you, because there are many reasons why they may not. You should be actively engaging your child and talking to him about it to make sure that you're out in front of this.
And then last is something that Steve and I are both equally passionate about, vaping. Are you seeing kids perhaps even turn to vaping as a stress relief valve?
I've seen some of the worst adverse events the worst consequences of vaping. Of course, it's been related to this life-threatening lung disease. We have seen children who have really had basically pulmonary failure due to the vaping. It's a very, very dangerous thing, and it's really quite shameful, in my opinion, that a lot of the companies design their products and their advertising to target children, even so they weren't. But what, to a certain extent, we're doing is promoting addiction. And nicotine is a drug, and it has effects on the developing brain. And we shouldn't, as a society, be promoting or allowing this type of thing.
I couldn't agree more. Well said.
Dr. Jeffrey Kahn, the Chief of Infectious Diseases at Children's Health. Thank you for your insights.
You know, Thomas, we've had some great segments today. And what I really like, the human side of healthcare. We assess the needs of the community, and then we try to address the needs of those humans.
This is one of those things, and one of the reasons why we do this show is because these things are going on in the background that you would not normally otherwise know about if we didn't bring them to light. So the whole reason we're here is to shed this kind of light on what the hospitals are doing in this community to make our health better.
And it's an integral part of improving the overall health of North Texas. Stay safe, wear your mask. If you get a chance to get the vaccine, do it. See you next week.